Hey doc, I hope you are doing great. Today we will be discussing about typhoid and also about its causes, symptoms, complications and its treatment. Typhoid is caused by Salmonella typhi. This organism enters inside by ingestion of contaminated material and reaches the terminal ileum where it causes swelling of pear patches. In case you need a review of what pear patches are, they are small groupings of lymphoid follicles in your small intestine, and they play an important role in how your immune system responds to possible infections. Clinically, the symptoms occur as following. In the first week, the person has fever that is usually high-grade and sustained, followed by headache, malaise along with relative bradycardia. Then during the second week, along with high-grade fever, the person develops rose spots. These rose spots are red macules that are about 2 to 4 mm in diameter, occurring in patients with enteric fever, which includes typhoid and paratyphoid. The patient also develops cough, epistaxis and abdominal distension with tenderness. And around 7th-10th day the patient develops splenomegaly. Third week is when the complications start to show up. The complications caused by typhoid fever usually only happen in people who haven't been treated with appropriate antibiotics or who weren't treated straight away. The complications include bowel perforation, hemorrhage, inflammation of the heart muscle leading to myocarditis, inflammation of the gallbladder called cholecystitis, and inflammation of kidneys which will be leading to nephritis along with bladder infections. One important thing to note here is that typhi colonize the gallbladder and carriers shed these organisms into the intestinal lumen and thus in the feces. It is gallbladder colonization and fecal shedding that leads to transmission and persistence of typhoid fever. Now let's discuss about the diagnosis of typhoid. The most accurate test for the diagnosis is blood culture. While the stool culture would delay the treatment since it would contain organisms during the second and third week. The treatment of typhoid is antibiotic therapy. Usually fluoroquinolones are prescribed over a course of 14 days while the resistant cases are treated with cephalosporins. Also, the chronic carrier states might require a cholecystectomy along with antibiotic therapy. That's all for today. We hope to see you soon. Thank you.